Glad to have you all here. It's exciting to be able to present to you the high blood pressure material. This has been a labor of love over the last several years. We got into just a full effort with teaching people about natural ways to help their blood pressure in about 2015 now. We really started going on it. And it was myself, Dr. David DeRose, and Trudy Lee who joined together and came up with the idea with the book. And we went ahead and uh, um, put it together. And it took some time to do that, but I'm so glad that we did. And it's going to be a pleasure to share with you. I have a background as a family physician and also in preventive medicine, and have a master's in nutrition, and have enjoyed teaching and studying nutrition for a long time. Here's my family, my beautiful two kids and my wife, and hopefully things will stay quiet in this rambunctious household while I'm talking to you. But if you hear any noises, that's them, and it's just part of the household activities. Here's the book, and if you miss something or don't catch something, it's certainly available there. And we're excited to be able to uh, give you this book if you come to all four presentations, and we'll give it to you at the end. So let's get into our talk now. So let's talk about high blood pressure in the United States. And high blood pressure is a big problem throughout the US. It's especially a problem in the South. Tennessee is right in the middle of it. About a third of Tennessee folks have high blood pressure. A third, 1 in 3. It's pretty phenomenal, and it's right up there with the other states on the southeast part of the continent. As you get older, your blood pressure goes up. That's what this slide shows. Here's the percentage of people with high blood pressure, and you can see as the age changes, the blood pressure frequency goes up. So, why is blood pressure dangerous? It reminds me of a story of, my patient who had just moved. This was when I was living on the West Coast. Had just moved over from the Midwest, and his wife had urged him to quit farming and move because he was having health problems. He was having high blood pressure and diabetes, and a lot of issues with that. And so she was hopeful that if they moved to the coast and started a more relaxing lifestyle, that would make a big difference. And she brought him in because he was having some chest pain issues. He was having some dizziness, and but he wasn't concerned about it. He was like, "Oh, it's no big deal." Whereas she's sitting there, kind of holding the the bench, kind of white knuckling through the whole visit. And we talked, and I offered them a workup, and he was not particularly interested in it, but we started on that process, and he did start to do that because of his wife's wishes. And I offered him an opportunity to come to a program very similar to this one, where we're giving talks on health and cardiovascular disease, blood pressure. And I rolled into the evening program. This was back when we were doing everything in person. And there he was. And I was so excited to see him. But the problem was he was in his truck and he was backing out of the parking lot while I was coming in. And I got out of my car, and I went up to his vehicle, and I'm like, "Hey, how are you doing?" We'll call him Bruce. "How are you doing, Bruce?" And Bruce was like, "Thank you, Dr. Steinke. I really appreciate the opportunity to join your program, but I got a lot of things going on, and I gotta take off, and I got some work to get done, and so on and so forth." And he just wasn't interested, even though he he checked it out for a minute. Anyways, I had a really bad feeling about him, and I let him go, but he I never saw him again. I got a call a couple weeks later that from a physician in the hospital who was doing hospital care, that he had had a devastating stroke, and She didn't think he was going to live through it, and he didn't. And that's the consequences of high blood pressure. You feel fine many times, or you maybe have occasional little symptoms, but um, the devastating event is sometimes just around the corner, and you don't know when it's about to happen. And so he had a stroke, and that stroke killed him. And I'm so sorry that happened. His wife was devastated. The confusion that can happen if you're getting confused with your blood pressure being high, that's called hypertensive encephalopathy. The aneurysms can happen all over the body, but especially in the aorta and also in the brain, they're common. You can have changes in your eyes that can eventually lead to blindness. Heart attacks are very much related to blood pressure, and then kidney failure. High blood pressure is one of the most common causes of dialysis and kidney failure. And of course, now that COVID-19's come along, if you have high blood pressure, you're twice as likely to get severe COVID-19. And so that's something to think about. Not only is high blood pressure bad, but treating it and getting it down is good. And so we want to get the blood pressure down. We want to get it treated. Here's the stroke example. So if you are under the age of 60 and you get your blood pressure treated, your risk of stroke drops in half. And I wish that would have happened for Bruce. If you are above 60, your blood pressure still, or your risk of a stroke still drops by 40%. So 50% if you're under 60, 40% if you're above 60, and you can do something about your risk of stroke. So what is blood pressure? Many of us know this already, but it's the force through your arteries as the blood leaves the heart. The top number is the peak force when the heart's just pushing the blood out. It's the peak force. As the force goes up, the arteries dilate some and embrace that force. And then the bottom number is, the top number is called systolic, the bottom number is called diastolic. And that's kind of when the heart's relaxing and the pressure is dropping down to its lowest level. So how high is too high? Well, here's one definition. Elevated blood pressure, elevated pressures represent forces high enough to cause problems to organs and tissues at the end of your pipes. So a definition that has been used for years now, normal is less than 120/80. In between that's pre-hypertension. Once you get to 140/90, you're in stage 1. And then 160/100 is stage 2. These were the JNC7 guidelines that have been standard for a long time. Recently, the American Heart Association did some adjustments, feeling that people should get their blood pressure even lower. And we'll look at some of that data so you understand some of the nuance there. But there are some drawbacks to that, and it hasn't been fully embraced by the medical world by any means at this point. All right, so here's an example of many examples like this. Here's the Mr. Fit study, a trial that was very large, looking at the risk factors related to heart disease, for example, heart disease death in this case on this slide. And so you can see as the blood pressure comes down, so here's the kind of the higher level, 151/98 at decile 10. As you move down the deciles, your blood pressure drops. And so your blood pressure, your risk of a heart disease death is lowest when the blood pressure is the lowest. And so that's the general principle is you want your blood pressure lower if at all possible. And Mr. Fit showed that there was no medications used. It was just showing the associations with heart disease death and what the people's blood pressure was as they were going through the trial. Here's the same trial looking at stroke death. And this is even a greater kind of uptick as you go through the 10 deciles. Same blood pressure numbers. You can see the systolic there, the diastolic on the bottom. And as your blood pressure goes up, you got to have a significant increases in risk. I mean, you wouldn't think 150/98 is all that high. Maybe it's a little elevated, but look at the risk of a stroke death. 8-fold for systolic above 151. And for a diastolic above 98, it's more than a 4-fold increased risk. So that's a big deal. And that's something that we need to pay attention to. Getting your blood pressure down into these areas here is ideal, and your risk starts to go up as soon as you're above 120 for sure. But the lower the better, within reason, of course. You don't want to be dizzy. You don't want to be cold all the time, because low blood pressure tends to make people feel a little cold in the hands. And but it does lower your risk of stroke and heart attack. So what causes high blood pressure? This has been a phenomenon of study for a long time. It's definitely been something that's not been easy to tease out. For most cases, there's no obvious treatable cause. You can't just pin your finger on one thing and say that's it. And so they've called it essential, meaning that it's multiple kinds of things going on. Usually there's genetic underlying issues. Many times there's intrauterine issues. So that's in the womb when you're a little baby. There's things that may have happened there that set you up for blood pressure. And then, of course, lifestyle, environmental factors are playing a big role as well. But, there's an important message that I want to tell you, is that two people might follow identical lifestyles, but due to different inherited tendencies, one may have high blood pressure and the other may not. And so keep that in mind. This is a big point. Why are some at particular risk for hypertension? Well, it has a lot to do with the kidneys. The kidneys are the usual culprit. And when you're in utero, how your kidneys develop play a big role. They learned a lot about this from kidney transplantation. If you have a person who needs a kidney transplant, their blood pressure will change based on the person who gives the kidney. So if whatever the person who gives the kidneys blood pressure was, now the person who received the kidney, generally speaking, will have that new blood pressure level. So that's a very common phenomenon that they see in kidney transplantation, and it taught us that the kidneys have a lot to do with this. Um, you know, Again, problems in utero, the intrauterine growth restriction issues. If you're a very small baby, that plays a role, and the issues related to the third trimester of gestation, um, is when your nephrons are formed. These are the little tiny units that filter the blood. There's millions and millions of them in your kidneys, and depending on how many you start with, as those break down through your life, they play a big role in when you get high blood pressure in many people. All right, so that's very important, and less of the nephrons develop when you're stressed, when the baby's stressed. So if mama's stressed or baby's stressed for some reason, there's something called uteroplacental insufficiency, where there's inadequate blood flow from the mother to the fetus. This stresses the fetus, and if it's happening in the third trimester, it's playing a role in their nephron development, the little units that develop. And of course, this is a function of the stress hormones like glucocorticoids and cortisol and so on. Okay, so because of those factors, although we'll be looking at lifestyle and other natural therapies, and they're very important, the presence of hypertension does not necessarily mean a person is following a poor lifestyle. So if they have high blood pressure or hypertension, it doesn't mean that they're not doing their best to follow a good lifestyle. And can we all learn more? Yeah, absolutely. We can all do better. But it doesn't mean that they're just totally flunking out. So how well are Americans doing at controlling their blood pressure? Well, this is from the NHANES data. This is a national survey that's done every year on people, and they collect the data and then submit reports on a regular basis on various topics. And when they looked at the blood pressure, you can see that the awareness of people as you go from the 1970s into the 2008 was the last one that we had on this that I've seen. The awareness has been improving, the treatment's been improving. This is percentages, percentage of people. So the treatments have been improving and the control has been improving, but it's still very, very poor. And so if you have 50% of people controlled, that's still not all that great, is it? And so what's the reason? Why are people a lot less controlled than we would hope for? I mean, if people are treated, why aren't they controlled too? Why aren't these the same? Well, could it be that the less than optimal control rates relate to the patient's lack of acceptance regarding the conventional approach to high blood pressure? And what is the conventional approach? You all know it. It's related to the pills the doctors prescribe. And although the experts recognize over and over and over that lifestyle is powerful, the focus and the foundation almost always is the medications. Here's a great example from the National Health Statistics reports. This whole article from September 2017, looks at primary care physicians and visits with patients diagnosed with hypertension. And you could read this whole thing, and there's really no focus at all on lifestyle. The whole focus is on medications and how well patients are taking them and what ones are taking and so on and so forth, and how often doctors are giving it. And so Dr. Kronish back in 2011 summarized it wonderfully by this statement: although counseling about lifestyle factors plays a role, prescribing antihypertensive medications remains the cornerstone of the medical management of hypertension. All right, so what is the biggest problem of blood pressure therapy? There you see it. I clicked it up too soon there. Anyways, the most common problem is that there are symptoms related to taking the medication so often, side effects, frequent urination, fatigue, dizziness, cough, exercise issues, sexual dysfunction, depression. And how many symptoms do people have when they have untreated high blood pressure? Most of the time, people actually feel nothing. They feel nothing. They feel just fine, thank you. And so if they go from this to feeling worse, that's not a great incentive to continue the medication and so on. And so it's a battle. Here's an example of the adherence rates of the medication. So here's different classes of medication. You can see that some of the classes, the beta blockers, very poor. The angiotensin 2 receptor blockers like losartan and telmisartan, et cetera, much better. But even so, much of the medicine is only taken about half the time over 12 months, and that's not real good. All right, having said that, there are dangers with overtreating high blood pressure. This has been a long-term debate going on in the medical literature. There's been many trials, many observational studies seeing the same kind of effect, where as you bring the blood pressure down with medication, so this is with medication now, it does quite well. And then there's kind of a nadir, usually around 130 with the medication. And as you pull it down too far for these patients who are on medication, you actually begin to see an uptick in cardiovascular deaths, heart attacks, strokes, heart failure. And so that is an issue, and that's something we need to consider. And so, in other words, the common solution for high blood pressure, as in medications, may create more pressure than the hypertension itself. Could there be a better way? Well, of course, there's a better way. Medications have their place. There are certainly people who need to take medications, but if you're not optimizing in full and fulfilling the potential of the better ways, the other ways, you're not meeting the benefits that you could achieve. And so could there be a no pressure solution? And that's our book, The No Pressure Solution to Blood Pressure. And it's a framework. It's an acronym, and it's a framework to give you the general structure of areas that we found during our research to be quite helpful to lower blood pressure. So here's our acronym: no pressure, nutrition, optimal choice of beverages, physical exercise, rest, environment, stress management, social support, use of natural adjuncts, refraining from pressors and excesses, and exercising faith in God. So during our program, we're going to go through each of these topics, and we're going to look at the research, and we're going to do our best to teach you something about these things. All right, but there are a few ground rules that you need to know when it comes to natural medicines, natural therapies, natural remedies. If you're on blood pressure medicine now, never abruptly stop the blood pressure medications. There are certain blood pressure medications, if you abruptly stop them, you will just have a spike in your blood pressure, and you could have a heart attack just from that. That has happened. It's called rebound hypertension. Um, Eliminating other drugs has on occasion triggered heart attacks. So that's what I just said. So that's really important. It is best to inform your doctor if making significant lifestyle changes. So if you're learning things in this program, and you decide, you know what, I could do a lot better. I want to do a lot better. And you start making significant changes. It's very important that you tell your doctor about it and that you monitor your blood pressure very carefully. We recommend in our book to check 3 times a day while you're making changes to make sure your blood pressure is not dropping too quickly. And if it is dropping, you can rejoice. That's excellent. But we want to make sure that the medications are being adjusted appropriately. Okay, and also remember the power of addition. We're going to be talking about many different therapies that, in and of themselves, the research often shows that there's only a few point benefit, maybe 5 points, maybe 10 points sometimes. But as you pull all these things together and you start to, in a more global way, improve your physiology so that your body takes care of the blood pressure itself, you begin to have a much larger impact. And this takes some weeks sometimes to pull all these lifestyle changes together. And so that's really important. So you say, for example, you have natural remedy A that lowers blood pressure 3 points, on the systolic, 2 points on the diastolic. You have natural remedy B that lowers systolic blood pressure 4 points, and then diastolic blood pressure only 1 point. And then you have natural remedy C, lowers systolic and diastolic blood pressures 2 points. Well, let's take those all together. You might think, well, then that's just additive effects. You just add it up and that's what it's going to be. But in fact, what we find often is that it's not just additive, it's multiplicative. And you instead of getting a 9 point and a 5 point improvement with the additive effects, you often will get a 13 and 10 point improvement, for example, when you add things together. And so that's a really important point. Okay, so we're going to look at the first two this time, and we'll cover some of the details with that, and then we'll end our talk. So 3 key nutrition principles. So principle number 1, very, very important, increase plant food consumption. That's why we're going to have a cooking demonstration, a little video for you with Rachel every time, because we want you to learn something about increasing your plant food consumption. Find ways to improve and increase what plants you're eating. Control calories, make note of where the calories are, and start trying to cut back on really problem foods, problem areas, and see if some of the pounds can improve for those who need it. And then decrease salt intake. That's certainly important. And when you increase your plant food consumption, you get more potassium and you lower your salt intake. They work hand in hand to really help your blood pressure. So let's take a look at the plants. So do typical diet practices make a difference? So this is a very important study, a very large study, an NIH-funded study on the Adventist Health Study 2. The Adventists are a very unique bunch because about half of Adventists eat meat, and about most Adventists do not smoke or do not drink. And so some of those confounding variables are not present, but there's a wide variety of different diets within the Seventh-day Adventist community. And so it's a great opportunity to study the science. And so you can see here that when it comes to hypertension, let's look on the right part of that graph, the risk of getting high blood pressure is different depending on the kind of diet you're following. So non-vegetarians had the highest risk of getting high blood pressure, and then semi-vegetarians, they are those who eat red meat, poultry, or fish less than once a week. They had a 25% reduction in getting hypertension. And then those who had were fish, pesco-vegetarians, were at about a 40% reduction in getting high blood pressure. And then the lacto-vegetarians had about a 60% reduction in getting high blood pressure. And then the vegans did the best. They were eating the most of those whole plant foods, and they had an 80% reduction in getting high blood pressure. Diabetes was exactly the same, very similar rates on that. And so a really, really important point here. This in some 90,000 people, a very large study looking at this. And so there's been many studies now looking at the value of a whole plant-based diet, a largely vegetarian diet. And so here's a summary article from Burkow and Bernard's saying the following. After reviewing 80 scientific studies, doctors Burkow and Bernard concluded randomized clinical trials have shown that blood pressure is lowered when animal products are replaced with vegetable products in both normotensives and hypertensives. And here's a large systematic review. So a very important research study looking at many different prospective studies in this case, and bringing all that information. It's a huge job, bringing all this information together to try to figure out what does the science say. And so here in 2017, this group went ahead and did it. And it's a fascinating study. To give you just the summary points, I put together a slide for that. So here are the food groups that either worsen your blood pressure or improve your blood pressure. We know a lot about this now. So notice that the food groups that lower blood pressure, they're all plant foods, pretty much. There may be a couple exceptions, but this is largely the case. And then higher blood pressure is largely animal products and sugar-sweetened beverages. And so nuts, whole grains, legumes, fruits, and green leafy vegetables lower your blood pressure. You raise your blood pressure if you eat red meat, fish, processed meat, sugar-sweetened beverages. People are surprised about fish. I was too. But, fish has a lot of toxins in it nowadays, a lot of mercury, and it may have something to do with that. So that's a great question why it's doing that, but it is a consistent finding. And so, this whole plant-based diet is really fascinating when you look at it from kind of a spiritual type perspective, because when you look at the Bible and you see how the original diet was recommended, you can see based on this verse in the first chapter of the book of Genesis that the prescription for food was basically herbs and seeds and fruits and these kinds of types of foods were the recommended food. And I think we do well to move in that direction. So why are plant foods so powerful? Well, dietary substances that are in plant foods relax your arteries. They make them get bigger. They go from being constricted to relaxing, and that's very helpful. So magnesium and calcium, diets rich in magnesium and calcium give your arteries the ability to do this better. So green leafy vegetables, legumes, so the little tiny legumes, the beans and so on, very loaded with magnesium. Green leafy vegetables are loaded with calcium and magnesium. Nuts and seeds, very high in magnesium. So nuts and seeds are healthy. They're not unhealthy. They're very healthy. There are also ACE inhibitors. That drug, ACE inhibitors, the medications that we often use for blood pressure control. There's medications in the food. There's ACE inhibitors in the food. Here's the list, and you can make note of the various things. A lot of different things, a lot of variety of different things, from grains to tubers to nuts and seeds, and so on. And of course, one of my favorite seeds is flaxseed. Flaxseed is very powerful for improving blood pressure. And this study showed the same. Basically, it was a 6-month study, and it was blinded. They were able to hide the ground flaxseed in muffins and various food products, and the people had no idea which one they were eating. And they monitored their blood pressure, and at the end of 6 months, this is what they found, that the systolic blood pressure was 10 points lower, and the diastolic blood pressure was 7 points lower in the flaxseed group compared with placebo. Whereas if they entered the trial and they had uncontrolled blood pressure, they didn't have it more stable, and they just looked at those subset of folks, the reductions were even greater. It was 15 points systolic and 7 points diastolic. So excellent stuff. And here you can see them in the graph, the improvements as time went on with the blood pressure. This is diastolic and systolic. So wonderful data there. and use ground flaxseed. It's wonderful. About 3 tablespoons a day is excellent. If you're on a blood thinner already, maybe cut that back a little bit because there is a little bit of blood thinning action there. Controlling calories. So that's the second one. We'll just take a really brief look at this. So in this particular trial, uh, they were able to lose about 8.5 pounds. And that, here you see 8.5 pounds, and that went ahead and improved the blood pressure systolic by about 3 points and about 2 points with an 8 pound weight loss. So, as the weight goes off and as you get more weight off, you do see an improvement. And of course, the sodium reduced in this trial as well. And so that likely improved it as well. Okay, so we just came off a class. Many of you were in that class, so we won't spend much time on it, but weight loss is very important. And these principles, 7 principles that we have on weight loss is in the book, and very basic stuff. Don't focus on diets, focus on habits. Never make weight loss your sole focus. Don't be afraid to make those lifestyle changes. Exercise daily. Make clean breaks with problem foods. Eat a good snack. Don't eat a good breakfast. Don't snack. Look at me. Eat a good breakfast. Don't snack, and eat to satisfy simple hunger, not appetite. All right, and last, decrease salt intake. So we know that there are some people who are more salt sensitive than others. And if you're salt sensitive, you need to be really careful about this because you can really shoot up your blood pressure. As you age, it gets worse. If you're of Caribbean descent, African Afro-Caribbean descent, it's more likely. This genetic marker can be tested GNA1I2. And then those with hypertension, those with metabolic syndrome, diabetes, chronic kidney disease, and obesity. So if you're starting to get the underlying chronic illnesses, you start to get more and more salt sensitive. All right, and salt is a really important issue. We know that you lower your risk of heart disease and stroke if you lower your salt intake here 3 grams, and it made a huge difference. There's a significant number of lives that could be saved if we just lowered our salt intake. And so Bibbins Domingo, back in 2010 in the New England Journal of Medicine, gave this summary statement. The cardiovascular benefits of reduced salt intake are on par with the benefits of population-wide reductions in tobacco use, obesity, and cholesterol levels. A regulatory intervention designed to achieve a reduction in salt intake of 3 grams a day would be more cost effective than using medications to lower blood pressure in people with hypertension. Okay, so where's our salt found? People always say to me, hey, I don't use salt. I never use salt. I never add salt. Well, the thing is that over 75% of our salt intake is from processed and restaurant foods. And so they hide it in the food. And you say, well, it doesn't taste that salty. Well, it's hidden and you can't taste it. And unless you are the cook, you don't know. And so, we get some naturally occurring salt, which we need. The more salt in our water, for example, the more our blood pressure tends to go up. And while eating is only 6% of our salt intake is added salt. And then home cooking, we add a little bit. But most of it is in the restaurant foods, for example, this spaghetti sauce. All right, and then lastly, we'll just quickly look at beverages. What are the best blood pressure beverages? Well, definitely not alcohol. Alcohol raises blood pressure, especially at 3 drinks or more a day. Binge drinking for sure, and even moderate drinking puts on calories, can make you gain weight, which will raise your blood pressure. And then if you're on blood pressure medications, it's not a good idea to drink alcohol because of the interactions that can occur. All right, soft drinks. Soft drinks are no better. In fact, soft drinks are a big problem when it comes to high blood pressure. And here's a look at multiple studies and what the increased risk was of getting high blood pressure. So this is about a 6% increased risk up to about a 55% increased risk just with soft drink intake. So those who drank more soft drinks had a higher rate than those who drank less soft drinks, and the total summary statistics was about a 12% increased risk in these 6 studies. And so they were able to find a dose dependent effect in these studies, and that dose dependent effect was 8.2% for every additional soft drink a day. Your risk of hypertension increases by 8.2%. Okay, so why is this happening? What it doesn't make any sense. Why do soft drinks start you onto the road of hypertension? Well, it has to do with weight gain and the fact that liquid calories do not provide you any satiety. That means feeling full, and therefore you don't limit any of your food at meals, and you just add calories separate from the meal or on top of the meal. All right, and so that's a really important point. So it's the weight gain, and that's why you get blood pressure problems with soft drinks. So let's give an example. A 12-ounce can of soda packs 150 calories, 50 grams of sugar, many times 10 teaspoons of sugar equivalent. And if you did that every day, where you added a single soda every day and you didn't change your intake at all, you would gain 15 pounds that year. Just one soda in addition to what you need for your daily calories. What about caffeine? Well, caffeine is very similar to adrenaline, and caffeine raises your blood pressure as well. So if you're taking caffeinated drinks and you have high blood pressure, it doesn't make sense. Or the reviews of caffeine's acute effect on blood pressure indicate changes of 3 to 15 points systolic and 4 to 13 points diastolic. So these changes last for about 30 minutes, start at 30 minutes and peak in 1 to 2 hours for 4 hours. And so it's a 4-hour effect. And if you're taking multiple soft drinks or coffee or caffeine or something per day, then you're going to be, raising the blood pressure throughout the day. So Dr. James, back in 2004, long ago, did a very critical review of this, and he felt that this issue of dietary caffeine should be taken more seriously. If you like coffee, you can take decaffeinated coffee. That would be much better. There's extensive evidence that caffeine at dietary doses increases blood pressure. When considered comprehensively, findings from experimental and epidemiological studies converge to show that blood pressure remains reactive to the pressor effects of caffeine in the diet. And that's from Dr. James's review of all the medical evidence at that time. So what should we drink then? Well, water. Water, some people don't like water. They struggle to drink water, but I encourage you to find a way to get it into your repertoire. There is research showing that water is good for you. And for example, this study suggests, based on the associations, that those who drink more water have less fatal heart disease risk. And it's about 40% improvement in women who drink more than 5 glasses of water a day, and it's over a 50% improvement in men who drink over 5 glasses a day. So that's pretty fascinating. It has to do with the thickening effect of your blood when you're dehydrated. And then fluids other than water, there's an increased risk, and that increased risk, has been debated about, but has something to do with the concentration of the solutes that you're taking in, the amount of particles that are in the fluid, and the body has to take water out of the blood and reduce the concentration of the solutes in the intestines so that the solutes can go in without a big concentration issue there. That's the hypothesis. Whether it's true, we still need to detail it out further. But there is an increased risk seen if people are taking a lot of other fluids other than water, as in 6 glasses a day of other fluids. So less than 2 glasses a day of other fluids, that's probably not going to be as big an issue. But if you're living on soft drinks or even juices, if you're living on juices and taking a lot of it, there may be an increased risk, especially in those who are already at high risk. What about other issues, other problems that water can help? Here's a list. Constipation, that's obvious. Diabetic issues, getting that blood sugar down, drinking more water helps dilute the high sugars. Urinary tract infections, lots of water. Kidney stones, lots of water. Your urologists are repeating over and over the benefits of water and neglecting it and getting kidney stone issues. And then even gallbladder disease is associated with water intake. All right, that's my lecture for tonight.